Hello, I'm Terry Lynn Heath, menopause specialist and mobility coach. Thank you for being here with me to learn about how to talk to your doctor about perimenopause. During our time together, we will talk about the differences in the stages of menopause, how to choose a menopause-informed provider, how to prepare for your appointment, how to track your symptoms and lifestyle habits, and what it looks like to take action now. Before we begin, I'd like to share a little bit about me so that you know why I do what I do. I am a mom first. I have a 13-year-old daughter. I'm a menopause coaching specialist certified by Girls Gone Strong, an exercise professional certified by ACE, and a functional range conditioning mobility specialist. I'm passionate about empowering women to change their relationship to their bodies and their health through movement and self-love. Since losing my parents in their early 60s and struggling to have my own daughter, I have grown to appreciate my life in a new way. I like to say I'm radically dedicated to my health. I have overcome addictions and injuries by transforming my mindset and finding solutions to support healing. My highest goal in life is to live to be 105, and every choice I make is tested against that goal to ensure I do everything in my power to reach it. I came to menopause work through mobility work. I tore my MCL and PCL in 2019 when a couple of dogs ran into my knee at the beach. I looked for ways to support my healing in order to be able to continue dancing. I found joint strength work and was sure it was the next big thing in fitness. And it is definitely emerging now more in the industry, which is really exciting. I healed myself and became certified to teach mobility to add to my repertoire of fitness and healing certifications. What I learned changed me in my perspective on how our bodies can heal. Because the information coming from our joints is prioritized by the brain, it means that our ranges of motion are of the utmost importance to our health span. When I applied the concepts of joint strength work to managing menopause symptoms, I became intrigued by the possibilities of the impact of movement. Today, I work with women to increase their body awareness, joint strength, muscular strength, and mindset to optimize their experience of menopause. I am postmenopausal at 48. I thought this was early, but it turns out the median age of menopause in the US is between 48 and 52. This leads me to why I'm here with you today, to raise awareness that menopause doesn't necessarily happen in your late 50s. I want to bring the peri and menopause conversation to women in their 30s, 40s, and 50s to support them getting the care they need. So let's get into it. Let's discuss the differences in the menopause stages. I hope to provide some clarity here, as the entire transition is commonly referred to as menopause. You'll hear people say, I'm starting menopause. My doctor said I should be done with menopause by X date. I think I have 4 years left, etc. So what does that even mean? Perimenopause marks the beginning of the transition toward menopause. This stage usually lasts several years, but you can see on the slide there is a major window of experience. As reproductive hormones start fluctuating downward, women may start to notice menstrual cycle disruptions and other indications of hormonal shifts, or they may not notice anything at all. Women can still get pregnant during this stage, but chances decrease over time. There are two stages of perimenopause, early and late. During early perimenopause, there are fewer and fewer viable ovarian follicles. FSH increases and yells louder at estrogen, which is slowly declining, to pick up the pace. Things start getting a little unpredictable. Statistically, if a woman starts skipping 2 or more menstrual cycles in a row, there's a 95% chance she'll have her final menstrual period within the next 4 years. Late perimenopause is officially defined as 3 to 11 months without a period. When women do menstruate, they may or may not ovulate, and estrogen may be low or high. It can be thought of as a speed bump of the menopause transition. In simple terms, the feedback loop gets wonky and the body system somewhat short circuit, trying to make up for the fluctuation of hormones. During perimenopause, you may experience hot flashes, night sweats, sleep difficulties, mood swings, headaches, joint pain and stiffness, back pain, difficulty concentrating. These symptoms correlate directly to lowered reproductive hormones, since there are receptors for these hormones all throughout the body that are not getting the predicted levels of communication. Hormones are communicators throughout our body, so you can think of someone whispering to someone who is hard of hearing or yelling at someone who is sensitive to noise. It can be a chaotic experience occurring throughout our body's communication system. And these hormones tend to decline at age 35. Since our hormones start fluctuating in our 30s, it's necessary that we begin this conversation much earlier than we previously thought. Menopause is officially declared 365 days after your last period. Since we don't know when our last is our last, 12 calendar months are used to define this milestone. This bit of uncertainty of when someone is officially moved from perimenopause to menopause can make the experience even more challenging to process and understand. The exact age a woman reaches menopause will be determined by many factors, including lifestyle, genetic, and hormonal factors. Their experience of menopause will vary widely, as no two women are exactly the same. There has been no relationship shown between the onset of menstruation and the age of menopause. During menopause, the changes you learned about earlier continue to progress. FSH will plateau, and our estradiol and progesterone lower significantly. The loss in testosterone production also affects us, potentially leading to changes in sexual function and interest. Symptoms may continue or begin during this time. They can also be very minimal. So, again, a very vast experience. Sometimes we women don't have any symptoms at all until postmenopause. Sometimes everything ends at postmenopause, so it really varies from person to person. Postmenopause can feel like a relief or a loss. We've talked about each woman being unique and having their own experience of menopause. Menopause is not an on-off switch. Hormones continue to fluctuate during postmenopause. Different tissues in our bodies can produce DHEA, which can be converted into sex hormones like estradiol and testosterone. The risks of chronic diseases like heart disease and cancer rise sharply. Estrogen and progesterone help protect younger women against many of these diseases. This is why postmenopause is a crucial time to build and maintain healthy behaviors if you have not already implemented habits to support your health span. Here are just a few of the symptoms that people may experience during perimenopause, menopause, or postmenopause. Joint pain, migraines, mood swings, brain fog, hot flush. I say hot flush instead of hot flash in this case because these vasomotor symptoms can feel like a wash rather than a flash. So it wells up, the heat wells up and kind of distributes all throughout your body like you're being flushed with heat. Sleep deprivation, dryness, and this can be dry skin, vaginal dryness, hair dryness, pelvic floor dysfunction, which can mean many, many things involving the actual muscles of the pelvic floor. These can include incontinence or prolapse, poor digestion, anxiety, and I have the number 85 here because a menopause educator, Andrea Donsky, mentioned or identified 85 symptoms, and I've heard numbers upwards of 100 as well. So all of these symptoms are associated with the fluctuations in hormone levels throughout the menopause journey. And we'll talk a little bit about treatments here, super high level overview. There are hormone replacement therapies that are called HRT or menopause hormone therapies, shortened to MHT, and they're fairly used interchangeably. There are countless combinations and dosages of hormone therapy that are specific to each individual's health factors, risks, allergies, and family history. This is one reason it is so important to find a menopause-informed healthcare provider who is skilled at delivering treatment of this kind. Naturopathic remedies are abundant as well and are prescribed according to specific test results. Often a blood panel ordered by a naturopathic doctor will include additional markers of health, and more markers than maybe your general practitioner or OBGYN would order. Lifestyle shifts and habits are used to support the risks associated with menopause, as well as the symptoms. Sleep disruptions and deprivation have been referred to as the main symptom of menopause that all the others are impacted by. So prioritizing sleep hygiene is the first recommendation I make to my clients when they are impacted by symptoms. Increasing protein and activity are a close second. Now that we've covered some education about the different stages of menopause, let's shift to how to find a menopause-informed provider and why it's so important. The study referenced here was conducted recently by the Mayo Clinic. I'll read it here. In a recent cross-functional study conducted by the Mayo Clinic of 183 medical residents, 93.8% believe that more curriculum about menopause should be included in their programs. 6.8% feel prepared to care for a woman in menopause. That's a really low number. Findings also included a low rate of comfort with prescribing HRT or MHT to perimenopausal women. This demonstrates the importance of finding a care provider who specializes in treating women throughout their menopause journey. I hear from women all the time that their doctors didn't spend enough time with them, didn't validate them, or told them that they were too young to be experiencing menopause symptoms. Granted, our bodies are complicated and we don't want to overlook other causes of symptoms and lump everything under menopause, but it is just as important to look at the possibility that we may be entering menopause or perimenopause even in our 30s. Research in this area is picking up. More attention and funding are being dedicated to women's health, and encouraging conversations are happening, like this one. Providers who specialize in all stages of menopause include naturopaths, OBGYNs, and endocrinologists. So what does this mean for you? Finding a menopause-informed provider can be done through the recommendation from a menopause specialist. Like myself, I have a large referral network, and any menopause specialist or coach should also be able to help you find someone in your area. Your primary provider can also help with this, or the North American Menopause Society, now called the Menopause Society, is a great resource. You'll hear this a couple of times throughout this presentation. And what are you looking for? You're looking for a menopause or perimenopause management mentioned in a summary published by the practice. You can also call the office and ask directly about their specialization in perimenopause care. There are options in person or virtually. Many practitioners can see patients virtually if that is best for you, and they can often spend more time in the virtual setting. Now, let's talk about how to prepare for your appointment. Tracking, defining goals, and doing your research are things that I recommend for you to prepare for your appointment. Your doctor will have their own forms for you to fill out, and you should do this as much in advance as you can of that appointment, so they have time to review your health history and symptoms. But don't stop there. You can do so much more in advance to ensure a productive and focused conversation. How often have you been in the doctor's office and felt rushed or stunned by some result, or have a mindless moment and can't remember your questions? I have had all of these happen to me. You can count on the doctor having other patients or feeling rushed themselves, so coming into the appointment with a summary of your tracked symptoms, your health and lifestyle goals summarized in a few sentences, and 3 questions based on your goals, research specific symptoms and lifestyle circumstances will keep the conversation focused. You can lead this conversation even though you're not an expert on menopause. You are the expert of you, and this is your care we're talking about. You deserve the time and attention necessary to address your specific case. The doctor you've chosen should be able to address your concerns and have a conversation that is informed and respectful. If they are unable to provide you this, find another provider. You'll hear me say that again because I believe strongly in that. Because once you define your goals and research and have your conversation all mapped out, the doctor that you're working with should be able to address your concerns and answer any questions in an informed way. And if they can't do that, they can either let you know they'll get back to you, or you can find another provider. So tracking, defining your goals, and doing your research. We'll take these one by one. Tracking. This is perhaps my favorite thing to do these days besides spending time with my daughter. This can be done in a simple Google form. I really like a Google form because it is straightforward. You can edit it to include notes and add anything in it that you want to track in relationship to one another. For example, I started simply tracking my meals and my symptoms. I was having terrible headaches and a hard time sleeping. I wanted to see if sugar had anything to do with it, so I reduced sugar and increased protein. Once I got used to tracking that, I edited the form to include water intake and sleep length rather than just noting the sleep disruption. So as you get into tracking, you can edit your form to include more variables to weigh against each other, and those things that are entered into the form get pushed to a Google Sheet, so you can see them all in line with one another by date, and you can get a really great idea about your trends really quickly. So what you want to track are cycle, sleep, symptoms, nutrition, exercise, and family history. Let's take these one at a time. So cycle, track your length, flow, and cramps. Any moods associated with your cycle are also helpful, as these can change throughout your transition, and they can give you some information about how you're progressing through perimenopause. Sleep, track your duration of sleep per night and your sleep quality. Symptoms, note the severity and frequency of your symptoms over time. Nutrition, be detailed here. As you learn more about what your body needs, you can track nutrients to see if a more balanced diet impacts your symptoms. As I mentioned, when I upped my protein, my migraines were impacted and reduced quite a bit. Exercise. Exercise can include light yoga, stretching, walking, and even 5 minutes of abs. All movement counts and helps to define your activity level and impact health. Family history. This is an important thing to collect ahead of time. Think about diabetes, heart disease, cancer, things like that are important to calculate for your doctor to calculate into your risk factor with different treatments that he or she might, that they might prescribe. There are I'm going to back up here. There are different apps to track these symptoms. I don't have any endorsements or recommendations for any in particular. I have found that many are directly connected to care and treatment. So they are, they'll ask you to track, and then they'll also push you to a consultant or a specialist. So just to be aware of that, it might be the kind of arrangement that you're looking for, which is great. And if that is the case, it may make sense for you to just go directly to the tracking function in one of those apps. I know there are a couple that actually accept insurance, so that could be a nice way to go if you would plan on seeing someone virtually. And they are definitely informed as to what women experience during perimenopause and menopause. I recommend that you still go through the process of defining your goals and values around your lifestyle, doing the necessary research to inform and educate yourself about your options, and finally crafting your questions based on what you have learned. So let's talk a little bit about defining your goals and what I mean here. So having a few lifestyle goals identified and values highlighted to help you guide the conversation with your provider is a great idea. Even if you don't share your goals word for word with your provider, they can serve as your inspiration for advocating for your care and as the filter for the options you're presented with. To start, brainstorm some values that are important to you. Values are descriptive words like strength, compassion, gratitude, independence, joy, longevity, health, authenticity, flexibility, autonomy, community, connection, beauty, respect, motivation, efficiency, just a few. Make a big list of these, then narrow it down to your top 3 or 5. Then do the same thing with your goals or your big rocks. They're big themes in your life that you prioritize or want to do in the future. Some prompts for those are: what types of work or leisure activities get you most excited? What do people count on you for that you enjoy providing? What are the things you're most passionate about? What are the most important people, or who are the most important people in your life? How do you want to spend your time? Now you can take your top 10 big rocks or goals and reduce them to your top 3 or 5. From there, you're ready to form a few sentences. A couple of examples here. Because of my values of adventure, independence, and joy, thriving for me means spending this next phase of my life traveling and exploring, both by myself and with the people I love, and prioritizing rest when I can so I have the energy to do these activities. Thriving during menopause means that I'm experimenting with new meals in the kitchen, hiking up mountains and crushing heavy weights in the gym, practicing meditation on a daily basis, and continuing to see my therapist every other week. Most importantly, not worrying about fitting into my skinny jeans because I'd rather put that mental and physical energy into living according to my value of strength. This exercise and these examples are courtesy of Girls Gone Strong, my menopause coaching certification program. These are the bones of the menopause vision statement intended to serve you throughout your menopause journey as your North Star. It is so helpful to do this prior to an appointment to help guide the conversation. Research. Ask, reflect, apply. What you're doing here qualifies. Simply learning about the menopause transition from a menopause specialist is a great place to start. From here, seeking resources that are science-based, and asking questions of the research as to how it applies to you. Women's health research is increasing, which is phenomenal, as we've discussed. And with more research comes more information to sort through. Train your brain to go to the source when you hear any headlines designed to grab your attention. Some strong sources of information regarding menopause are the North American Menopause Society, and the National Library of Medicine. These both offer research publications to the public. When approaching any research, ask yourself, who was the sample? Reflect on what concerns you or interests you and apply it to your life based on your values and goal statement. Print and bring studies with you to your appointment for direct reference during your conversation. Now it's time to put all this work together to craft your questions for your provider. Take your tracking, your research, and your goals and use them to support your top 3 to 5 questions for your provider. Write them down and bring them with you to your appointment just in case you need help remembering in the moment. Remember, an informed menopause provider should be able to address your questions, validate your concerns, and draw on specific data for your unique circumstances. Healthcare expenses add up quickly, and it is in your best interest to be poignant and focused during your appointments. If your provider isn't the right fit because they appear uninformed or dismissive, my hope for you is that you realize you have other options. There are likely other providers in your network if you need to utilize your insurance solely for care. If you have the option to look out of network, your pool of providers increases with naturopathic doctors and other functional medicine doctors. Spending time researching the doctors available to you and finding the right fit before making an appointment will increase your chances of finding care faster and saving time and money. The prep work ahead of time that we've discussed will also benefit you tremendously. So now that your tracking goals and research are complete, here's a couple of examples. Think about what you discovered about your trends. How do your symptoms affect your life? Do they keep you from planned activities, affect your intimacy, embarrass you? Do you feel that you have the power to affect your symptoms with lifestyle shifts? Based on your goals and values reflection, what priorities do you want to communicate to your provider? What are non-negotiables for you? What did you learn in your research that concerns or interests you? Do you have family history or health conditions you believe will affect your options? A couple of ideas here that I wanted to share. What are the side effects of this treatment based on my non-negotiables? Do you think this treatment supports my goals? Will I need MHT for the rest of my life? Is it best to begin treatment now based on my health span goals? What are my other options if I don't choose HRT? Since my finances are tight, is it better to try supplements and lifestyle changes first? So those are a few questions. So just to review, you want to track, you want to define your goals, take some time in defining your goals and your values. You want to research, talk to menopause care providers. You can research by calling the doctor's office and learning more about them. And then finally, crafting your questions to prepare for that appointment. And while you're doing all that, what can you do now to impact your symptoms while you are preparing for your appointment? You can sleep and you can eat and you can move. And these are all things that are available to you now and are so simple, yet so impactful. I believe our bodies were built to heal, and with a little direction and support, we can make a big impact on our health and comfort through these simple practices. While you're doing all the work to prepare for a visit, focus in on how you are providing your body with these 3 things. Sleep, prioritizing sleep to support your other activities. 7 hours a night is the proven sweet spot. Create space for sleep in your life now for maximum benefit. Nutrition. Women in all stages of menopause should be getting at least 0.9 grams of protein per pound of body weight. It all adds up. Look for nuts, cheeses, and carbs that pack the protein in addition to meats. Fitness, there is no replacement for exercise, even when implementing hormone therapy to protect against bone loss. Look for activities you enjoy to keep you active because it's so important to enjoy what we do. I hope all of this has been helpful for you and you've gleaned some nuggets that you can utilize. Before I close out, I wanted to share something special. I'm hoping it will be okay if I let you know about a program I'm offering. I wonder if you're feeling symptoms you can't get relief from, defeated by injuries or setbacks, insecure about your body, unsure what exercise to prioritize, unprepared to meal plan for your family, alone and scared about your body's changes, not sure if you're in menopause. I have the program for you. I'm excited to announce Optimize Your Pause. It is a 12-week intensive designed to help you fall in love with your future. Whether you're in perimenopause, menopause, or postmenopause, you will benefit from education around the health of our pelvic floor, cardiovascular health during menopause, bone health now and beyond menopause, along with fitness modules designed specifically for your goals. This program includes customized fitness plan according to your goals, lifestyle and behavior change support, community accountability and one-on-one coaching, mindset, motivation, and management tools, menopause education and symptom management, self-care modules and workshops. Create your menopause vision statement to serve as your North Star throughout your journey. This program is designed to help you transform your relationship to your body and end the dieting cycle once and for all. Learn to move your body in impactful ways to truly support the health of the pelvic floor, gain strength to support your joints and bone health, and reduce pain. Manage your symptoms in a sustainable way that will support additional treatments. It is designed to learn how to move your body to support your pelvic health, your joint health, your bone health, your cardiovascular health, and your brain health. Optimize Your Pause is designed to help you manage your symptoms in a sustainable way, even if you are implementing hormone therapy or other treatments. Exercise is a non-negotiable, and this program is designed by a menopause specialist, informed exercise professional with menopause top of mind. There are many risks associated with menopause, and exercise checks every single box. You'll enjoy 12 weeks of lifestyle change support, 24 live coaching opportunities, 100 plus education and fitness modules, menopause education, self-care techniques, including face yoga, lymphatic drainage, meditation, breath work, and somatic practices. All of my programming aligns with the pillars of mobility, mindset, motivation, and management. So all modules offered support one of these pillars. For real lasting transformation to occur, we must go deep and master these. I wanted to say thank you so much. All of this is offered at a significant discount currently. This is the same pricing I'm offering my waitlist, and there are limited spaces available since I will keep the group small intentionally. Click the link accompanying this masterclass, and I look forward to seeing you on the inside. You can also go to themovementpath.com/join/or-today. Hope to see you soon. Thank you so much. Bye for now.